Good evening, everyone, and thank you so much for joining us this evening, and a very warm welcome to our ninth webinar on our brand new practitioner series. And today the topic is all about men's health. My name is Ella and I'm the practitioner lead here at DR.VEGAN, and we also have with us today our very special guest, Mark Killick. He's a functional nutritionist and has a special interest in men's health. Many of you on this call today will know Mark from previous webinars and also a bit of lecturing. Now, before I start, I want to quickly mention that our practitioner webinars are intended only for professionals. So this includes trainee nutritionists, nutritional therapy practitioners, dietitians, naturopaths and pharmacists. And they are not intended for members of the public. Okay, so to start, I want to give a brief introduction to myself and Mark. So firstly, I have a passion for practitioner education and have previously worked in lecturing and clinical supervising role at a major nutritional therapy training institute. And I've since put my passion for education into training practitioners at DR.VEGAN and creating materials that make clinics easier and more efficient. And we're also thrilled to welcome Mark Killick. So he's a functional nutritionist, as I mentioned just now. So Mark, do you want to tell us a little bit more about yourself?
Yeah. Okay. So yeah, I've been nutritionist now. I qualified back in 2007. So been in the industry a while. Worked in different parts of it. I have my own sort of a private clinic where I see clients. And I mean, Ella and I actually met, you know, at a time where we were both sort of in the supplement industry for a while. So that's where we go back. And yeah, for the past 10 years, I've been lecturing at C&M. So this has led me into different areas of health, and this is one that I want to share with you tonight. You know, sort of like the andropause, as I put it, and I think it's an area that we see a lot more. We see it a lot more spoken about in the next few years that come along. So yeah, really good to be here tonight, and looking forward to delivering some useful information to you. So thank you.
Perfect. Well, welcome, Mark. Now, before we start, I do want to add, please do feel free to ask any questions that you have along the way. Do type them into the questions box. We will be having a short question and answer session at the end where we will be answering your questions. And we will probably only have time to go through a few questions at the end. So if yours doesn't get answered, or if there is a question you don't feel comfortable asking on here, please do reach out to myself and I'll be able to help you. And I'll also be sharing my email address at the end. So without further ado, let's get going. Okay, so today we're going to be covering a range of topics to do with men's health. We're going to start with some statistics. Then we're going to look at, does the andropause actually exist? And what is it? What are the symptoms? Why testosterone levels have fallen in men recently or over the last decade, and what can we do about it? We're going to be looking at testosterone replacement therapy, and also why it's not just all about testosterone. We're also going to be covering erectile dysfunction and also a holistic approach to the andropause. I'm also going to give you an introduction to Men's Pro Multi, and of course you can claim a free one of those at the end of the session, so do stay on to the end and I'll give you details of how to claim that. And then we're going to have time for questions and answers at the end. Okay, so let's have a look at a few statistics. So the life expectancy for men is 78.8 years, and that's compared to 82.8 years for women. So it is less, you know, significantly less for men as it is in women. And we're going to cover some of the reasons why a little bit later on this webinar. There is an estimated 133,000 men who die prematurely in the UK. That's in 2023. And that's about 2 in 5 men, and 2 in 5 men that die before the age of 75. So that's quite striking when you think about in comparison to how long women do live. And then we've got avoidable mortality rates. They're much higher among men. So in 2019, preventable deaths were 89% higher in men than they were in women, and treatable deaths were 19% higher. So again, you know, that's you know, these statistics, when you compare them to women's health statistics, that is a stark contrast there. Okay, so I'm going to hand over to Mark, because Mark is really the men's health expert, and it's not really my forte. So I'm going to let Mark cover
Lovely.
Most of the webinar. So Mark.
Thank you very much. Yeah, thank you for the introduction, and thank you for the statistics. And I think I'm going to try and bring some sort of sense to those statistics as we explore many areas around men's health, in sort of not just the physical areas, but I want to touch on some of sort of like the emotional and psychological areas as far as men's health is concerned. So, and interestingly, I'm going to start with the menopause. You know, so like if you look at how the menopause has been viewed in lots of respects. It's sort of like between the 1930s and the 1960s, it was actually described as a deficiency disease. You know, sort of like then in the sort of like 70s, 80s, in the sort of feminist movement, it was started to be spoken about a lot more holistically, but it was still something that sort of women just got on with, you know, and sort of even with lots of debilitating symptoms that came along with it. Then in sort of these recent decades, especially sort of in 2021, the menopause has really come to the forefront with Davina McCall's really pushed the whole sort of spectrum behind that, and a lot more women are using HRT, you know, to help with symptoms. And the government has also sort of acknowledged how the sort of like the menopause can sort of affect women within the workforce as well, and sort of brought in certain guidelines around that. Now, the andropause, you know, if you look at the definition of it, you know, it's termed as androgen deficiency in the aging male. But by just describing it as that, we're excluding a lot of the other changes that actually take place as a man ages. And I want to add another sort of dimension to this, and it's something that might resonate with many. And I was actually speaking to a therapist that I use, and sort of and I refer to a lot of people to him. But we were reflecting about something called the rites of passage. You know, the difference between, you know, how a woman may navigate life compared to a man. So historically, you know, and this is across all cultures, you know, sort of like menstruation, you know, sort of childbirth and menopause, they sort of functioned as biological and social markers of transformation in a woman's life. So sort of like with menarche, the first menstruation, sort of marked sort of the woman's entry into womanhood. And often in some cultures, sort of like was accompanied by sort of rituals to signify sort of readiness for adult responsibilities. And then childbirth, you know, this is, you know, very powerful, often very sacred, you know, sort of like it was, you know, it was a symbolic act of creation. It often elevated sort of women's status, you know, sort of because they could give continuity to life, as it were. And the menopause, you know, sort of like that was sort of like the entry of a woman into sort of like that of the wise woman, you know, sort of moving from fertility to wisdom. So you had these biological events that sort of aligned with a sort of an acknowledgement of maturation within a woman. But these sort of these sort of passage of rights for men are often sort of like missing in sort of Western society. You have traditional societies that still sort of might mark it in some sort of way, but in Western society, you know, it's sort of like thing as far as a boy is concerned, it's sort of like maybe having their first job, their first time they have sex, you know, maybe actually having sort of alcoholic drinks or something like that. So, you know, there's no ceremony as such to the whole sort of passage of rights as a man. There's an author, Joseph Campbell, you know, sort of like who spoke about these lack of initiatory experiences. and it can leave sort of like a psychological adolescence that remains with men. Sort of like, so many men actually remain boys as they go through life. So there's no clear transition, so, and this is where I think we find this sort of surfacing around sort of like the andropause if we look at the age at which that sort of actually exists. So there's sort of a lack of purpose, sort of like responsibility, and a lack of a mature identity that actually a man actually has. So andropause in itself is not marked as such by an event. It's something that very gradually happens as a man ages. So if you can have the next slide, Ella. I think that's
absolutely.
So so symptoms. So it's very multi-layered. That's the thing. So like there's a wide range of symptoms that will affect sort of like the body, but the mind and also emotions as well. So there's many physical changes that start to take place. So you get an alteration sort of in body composition. Energy levels start to drop, sexual function and sort of like vitality start to sort of fade in lots of respects. All those sort of do impact the quality of life of a man. So men often start to lose muscle mass, put on more body fat, especially around the middle. And that then has a knock-on effect on sort of like the psychological and emotional impact. There's lowered body confidence, so reduced willingness to be intimate. And sort of like, so you get sort of psychosexual issues around loss of libido at this time as well. Emotional and psychological effects, include mood swings, anxiety, depression, irritability, decreased self-esteem. These are all things. So this is where we need to focus on things as a whole, not just the physical biochemical aspect of this period of time. So it's often a time when men really need to invest in their mental health and also develop certain coping strategies, at this particular time. Because one of the things that sorry, my Siri's going off. One of the things that Ella sort of intimated really was the fact that the single biggest killer of men up to age 50 is suicide. Sort of like, and after that, sort of heart disease. Males from 50 to 54 have the biggest suicide rate of all time. So it's a time that men also don't tend to maintain their social relationships during midlife. They're often sort of on their own, and if they feel vulnerable, they're less likely to open up about things that are actually taking place as well. So they sort of suffer in silence, as it were. So men are also less likely to seek professional help, and that can be anything medical or holistic help, sort of our area, if you like. And we find that men are sort of like more likely to turn to things like alcohol, drugs, etc. As they go forward in life. So all this sort of affects the relationships that they may be in and sort of the communication dynamics. So it impacts intimacy with partners, etc., and also with family and friends. And this is where we find with men sort of like things like apathy can start to take over, sort of, and purpose then sort of like starts to disappear as well, sort of around about this andropause time. But as I say, we're looking at this gradual process that's actually taking place. So if you have a look at the next slide, sort of like, so hello, yeah, that's lovely. So what we're doing here is we're having a little look at the androgen testosterone and how that's sort of fallen over the years. So this was something that's taken from reproductive biology and endocrinology. So it was actually published, this particular graph in 2020. And what you, I mean, it's difficult to see in some respects, but you've got 4 lines on the actual graph, and the top line is between the years 2006 to 2009. The bottom line is the years between 2016 and 2019. So you can see the testosterone levels have fallen, over those 10 years. And we can take that a little bit further in the fact that the average 22-year-old today has lower testosterone levels than the average 70-year-old of 50 years ago. So that's a significant difference. And testosterone is it assists in sort of like physical and psychological function. So that then has a positive effect on well-being. But we often think about testosterone, and it's rather stigmatized in society, you know. So, but it is a hormone that does really help men thrive. So one thing you'll see here also on the graph is testosterone tends to peak in our 20s, and then it declines at a sort of like steady rate of about 1 to 3% per year. So that means that by the time you're in your 50s, you could have testosterone levels 30 to 50% less than when you were in your 20s. But also sperm production has fallen 59% since the 1970s, and sperm counts fell on average by 1.2% a year from 1973, but that's actually accelerated to 2.6% a year since the millennium. But then this leads to sort of other physical changes that have affected men sort of like over the years. In 1995, there were over 152 million men worldwide who experienced erectile dysfunction, and the projections for 2025 show a prevalence of around 322 million men with erectile dysfunction. So that's an increase of about 170 million men. Sort of accounts for about 17%, 1 in 5. You know, so but if you take that a little further, because that's worldwide, there was a reported UK survey, and 41.5% of men reported that they suffered erectile dysfunction, and in the 40 to 70-year-olds that was 52%. So also men have become weaker as well, you know, sort of like the grip strength that's lessened as the years have gone by. And we also have mental changes. So you know, testosterone affects mood, well-being by influencing things like dopamine, serotonin, which leads to feelings of motivation, confidence, is sort of like stability. You know, but when we have low testosterone, we're more likely to have sort of mood swings, irritability, anxiety, depression, and that decreased sense of well-being. With it goes with lower testosterone. If I can have the next slide, please. So yeah, why has testosterone fallen? I'm not just picking on beer here, but there you go. It's complex. It's multifactorial. You know, so we have got higher obesity rates. That's across the board. You know, not just in men, but you know, across the board. So therefore, you get more aromatization of testosterone to estrogen. And with also the higher rates of obesity comes insulin resistance and more inflammation within the body. So these are the sort of changes that are taking place within the body. But also we can see that we've got. I'm sorry. I do apologise for watches and things that are talking to me. We've got more toxins, you know, so things like pesticides. They're responsible for decreasing concentrations of testosterone. They inhibit the release of sort of follicle stimulating hormone and luteinizing hormone, which we need to actually produce testosterone. And also pesticides have been shown they're shown to be responsible for the apoptosis of Leydig cells, which produce testosterone within the testes. Parabens as well, they're the synthetic preservatives. They're found in lots of common products, cosmetics, personal care, shampoos, lotions, makeup, sort of like some foods and pharmaceutical products. And phthalates, they act as anti-androgens, so they they interfere with both the production and the functioning of testosterone. And once again, phthalates are very widespread, sort of common products, PVC products, sort of like toys, flooring, shower curtains, personal care products, cosmetics, etc. In the phthalates in aftershave can be as high as 3.6%, and also within the food industry. I mean, so I used to work in the food industry years ago, but a lot of transport of food through pipes, PVC pipes, a lot of phthalates end up within the foods due to the food processing that takes place. Think about even how cows are milked with PVC tubing as well. So it's very widespread. BPA, bisphenol A. So I pulled out a study here whereby, and this was 2023 study in the human reproduction, and it disturbs hormonal levels and testes mitochondrial activity as well. So this is quite common. A theme to what I'm speaking about today is how mitochondria are affected throughout the andropause. So BPA itself will bind to estrogen receptors and have an estrogenic effect. But once again, it also causes destruction of the mitochondria within the cells of the testes, including the Leydig cells. And we do see ethanol, estradiol, the synthetic form in the contraceptive pill. So that's been detected in UK tap water. This is why filtration of your water or using reverse osmosis is probably important. But I think you've probably found as practitioners that not many people do that. More and more people do, but less and less, but not as many people that actually should. So if we have the next slide, Ella, that'd be great. So I'm going to go through these ranges in a minute, and you'll see these are from 1996, so a reasonable length of time ago. So it's very hard to actually find some figures, but but you ask any man whether they know their testosterone levels, and probably they don't. So there's no precise figure for the number of men in the UK over 50 who know their specific testosterone levels. But there's certain surveys that say that only 18% of men across all age groups have ever discussed their testosterone with a health professional. Less than 5% of men who exhibit symptoms that could be associated with low testosterone had received a formal diagnosis. So there's a large gap between symptoms and sort of medical confirmation. And over 55% of men surveyed were unfamiliar with symptoms and signs associated with testosterone deficiency. It's something that I do measure. Actually, blood testing of testosterone is sort of gold standard. And I do, in my men's bespoke blood test panel, I do measure testosterone levels. And I will measure these three levels here. So I will measure total testosterone, free testosterone, and also sex hormone binding globulin. So you can see here whereby sort of age ranges in sort of like 1996, it was sort of like 25 to 34 was 21.38, and free testosterone was 0.42. I mean, I'm sort of relatively happy with mine, because there's a lot we can do, and you'll find out this in a minute, whereby lifestyle can have a serious impact on testosterone levels. So my total testosterone when I last measured, which was only September, I think, was 22.2, and my free testosterone was 0.3. My SHBG was 51. So ranges can really vary, greatly for each group. So for 18 to 49s, the range can be anything from 8.7 to 29 for total testosterone. So you can see that there's a big difference. Next slide, actually, please. Once again, we've got a different range of figures here, and you can see they've come down even more. So this is from 2022. You can see how the range has dropped even more here. I mean, it's quite significant as far as the drop's concerned. So what sort of symptoms might appear when the testosterone levels actually drop. And also in this particular slide, I'm going to talk about sort of like the allopathic support where replacement testosterone may be considered. But I'm also going to tell you that actually replacement testosterone is not always helpful. So it really depends on the person. Decisions to actually start testosterone replacement therapy depends on the outcome of your assessment with the doctor. But there's certain thresholds from the British Society for Sexual Medicine that might help you understand. So testosterone levels greater than 12 nanomoles per litre typically don't require treatment, according to the BSSM. Testosterone levels between 8 to 12 nanomoles per litre might require a trial of testosterone replacement. And testosterone levels less than 8 usually require some kind of treatment. But as I said, there's caution with testosterone replacement therapy because, and this is why making changes to your diet and lifestyle can be very powerful, and it's worth, going down that road and that avenue. And I'm going to talk about that later, because if you go on TRT, we call it, you'll shut down your own testosterone production. So that then can have an effect on sort of future fertility. So testosterone is usually given via implants or injections and creams, so not via a tablet or anything. But there's certain other issues to consider if you have unnecessary testosterone. And let's face it, a lot of men will unnecessarily use testosterone. It has an impact on cardiovascular issues, so you get an increased risk of blood clots, which can lead to sort of pulmonary embolism, increase in risk of heart attack and stroke. Also prostate issues, so can stimulate the growth of any sort of prostate cancers, and also cause prostate growth, so benign prostatic hyperplasia as well. So other side effects, acne, oily skin, fluid retention, also breast enlargement in men can occur. So this is because sort of the excess testosterone is aromatized into estrogen as well. Sleep apnea can make that worse. But then there's psychological effects as well. So anabolic steroid misuse can lead to psychological changes. And adolescence, because you do, even down the gym, I do notice this, it can cause, the use of this can cause premature aging of the bones, and also can stunt growth. So this is something that, any TRT needs to be under sort of proper supervision. So can I have the next slide, please, Ella? So yeah, but the andropause, not just about testosterone levels. I know I spoke about testosterone because androgen replacement, if you like, but there's also other gradual changes that are affecting men, and this is the important thing to talk about. So yeah, insulin resistance, we're at that stage of life where that's starting to happen. So leads to obesity, type 2 diabetes, increases in inflammation. So especially within the cardiovascular system. So an increased risk of cardiovascular disease. Part of the reason is compromised nitric oxide production. So I'm going to go into that in a little bit more detail. It's one of my areas that I sort of really enjoy working with. And we see that down the bottom when we come to microcirculation. We talk about the same thing. Also, with insulin resistance, we can actually have an increase in leptin resistance as well. So that results in the vicious cycle of excess fat deposition and weight gain. We find that there's can be declining gut health taking place, less breakdown and absorption of nutrients, and gut health also includes dysbiosis. So we get less short-chain fatty acid production, affecting the gut-brain axis, production of neurotransmitters. So this is where that can lead to low mood and poor cognition. So we start to lose our balance within our neurotransmitter, within our autonomic nervous system. Our heart rate variability starts to decline as well. as we age, we get a decrease in human growth hormone, which helps us sort of maintain the tissue we have, and so combined with lower testosterone levels, this can then lead to muscle loss. So this is where resistance exercise is very key for a man at this stage of life. Sort of to do some kind of weight training can really help. Mitochondria. So we get falling mitogenesis, so production of new mitochondria, and also we get less apoptosis of the aging mitochondria as well. So we get less mitochondrial function. Mitochondrial DNA is severely affected by inflammation as well. So serotonin, dopamine, declines with age as well. And microcirculation I'm going to go into in the next few slides, because it's quite important. So next slide, please, Ella. So as I mentioned, our microcirculation suffers. This is showing the progression of cardiovascular disease as well. We become less efficient at nitric oxide production. So this is mainly due to increased inflammation. So partly caused by more oxidative stress, but leads to more oxidative stress and damage, and therefore build up of the atherosclerotic plaque. So this process rapidly increases between the ages of 40 and 50. So we've got high risk of coronary artery disease, coronary heart disease. Free radicals, as you can see from the bottom of this particular picture here, that is a hallmark of aging. As we age, we produce more reactive oxygen species. And also we're less able to eliminate those reactive oxygen species. So we get more accumulation of them, and therefore more oxidative stress, resulting in sort of oxidative damage in tissues within the body, especially at the cellular level. So we get, and mitochondria themselves are actually a source of these reactive oxygen species, which then leads to the mitochondrial DNA damage, partly caused by overeating as well. So what happens is that we get the superoxide anion, and it enters the phospholipid membranes, and it interacts with the endothelial nitric oxide synthase enzyme. And when it does that, it tends to, rather than producing nitric oxide, it produces peroxynitrite, sort of like once again an oxidative thing. And this also inhibits our own nitric oxide production. And therefore it limits the nitric oxide dependent sort of vascular relaxation. So we get more vasoconstriction within the arterial system, which then leads to more damage, which attracts monocytes to the area, which become macrophages. They in turn sort of start to attract other immune cells to the arteries through their sort of chemokines that they send out. So then we get more vascular aging as far as this diagram is concerned, and more plaque formation or atherosclerosis. Next slide, please. I'm playing a very, very, very interesting picture. So why have I put this slide in? Erectile dysfunction can be a red flag for cardiovascular disease. So it's an early indicator. It's a very early indicator. So we've got arteries in the body with different diameters. And when we start to sort of like have plaques that cause a 60% obstruction to the lumen, that's when symptoms start to present. So when we go to smaller arteries, such as the sort of penile arteries, we're going to start to see sort of that symptom first before we see the symptoms within the coronary, which is the sort of second one, and the carotid arteries. So, and then the larger ones are sort of the iliac arteries. So ED, or erectile dysfunction, can be the tip of the iceberg of systemic atherosclerosis taking place, it's usually our first alert sign, that manifests before sort of like major cardiovascular events. You're more likely to see that than say the intermittent claudication, which is sort of cramping, aching in leg muscles that can occur with exercise. And when we sort of get erectile dysfunction, I mean, sort of other things can sort of lead to erectile dysfunction, sort of like performance anxiety, relationship issues, etc. So there's still common reasons for erectile dysfunction, but its prevalence is really due to sort of like age-related sort of issues such as atherosclerosis, high blood pressure, other vascular disorders, and then we sort of see things like sort of psychiatric disorders, but endocrine disorders as well, such as diabetes as well, which can be a very underlying cause of erectile dysfunction. Next slide, if I may. Am I doing all right time-wise?
Yeah, you're perfect, Mark.
Great. So let's have a look at this. So this is the role of sort of nitric oxide. So nitric oxide, I mean, for me, it's a really exciting sort of kid on the block, as it were, for improving anyone's health, not just men's health. Nitric oxide is almost hormonal in its action. And it's sort of like really important, sort of like for vascular integrity here. So, but it's also vital for erections as well. So this is from a journal, the Journal of Clinical Medicine, and in 2021, and it looks at the HPA diseases and erectile dysfunction. So this is showing you the actual process that's taking place. So we get nitric oxide induced smooth muscle relaxation, and that then allows a series of events to occur. So as we get dilation of the arterioles, so we get increased blood inflow. Then we get trapping of the blood within the penis as well, and this leads to a higher pressure there than the systolic pressure. We have certain nerves. So we have certain nerves called NANCs. So they're sort of non-adrenergic, non-cholinergic nerves. So they don't rely on sort of noradrenaline or acetylcholine for the communication. They're relying on nitric oxide for them to regulate smooth muscle function. So you can see that nitric oxide here is a mediator as far as that particular nerve function is concerned. So diabetic erectile dysfunction is associated with an insufficient response to these nerves, these NANC nerves. So we don't get that vasodilation taking place within the arterioles of the actual penis. So results in reduced production of endothelial nitric oxide synthase, which is related to that endothelial dysfunction and atherosclerotic disease plaque formation. So yeah, there's lots of research and epidemiological data report up to 75% of diabetic patients have a lifetime risk of developing erectile dysfunction, and it's more common in diabetics than retinopathy or nephropathy. Yeah, the affection, things that affect the kidneys or the eyes. So nitric oxide, responsible for relaxation of muscle cells, and as well as the blood vessels as well. So it's systemic though. I'm relating this as far as erections are concerned, but it's systemic in the body. So this is where I'm going to bring it. I want to bring back the andropause to sort of changes generally happening as far as a man's concerned. So it means that cardiovascular health is at risk as well. But patients with proper concentrations of nitric oxide tend to enjoy better sexual function versus those with deficiencies. So we can't bottle or manufacture nitric oxide. And instead, we sort of rely on sort of the urea cycle, where sort of like nitric oxide is produced from citrulline and L-arginine. Yes, we can actually supplement those as well. One of the things that we must bear in mind when we use those as interventions is at the same time making sure that we're looking at inflammation in the body and the amount of reactive oxygen species, because otherwise the arginine will get converted down to the peroxynitrate. And so this is where we want to make sure that the diet's full of antioxidants as well. So next slide, please. Okay, so the holistic approach to andropause. So this is where, rather than just looking at one thing, we're looking at many things. So life balance. Remember, I said, this whole passage of rights as far as a man's concerned. So, evaluate whether you're dedicating time and energy to things that truly matter at this time of life. Is career overshadowing relationship? So finding balance in our life is really important. Allocating the right time to relationships, career, health, personal growth, to ensure that you lead a fulfilling life at this stage. Understanding hormonal changes, so having a clear idea of what's driving things at this particular times of life. Is it falling, besides testosterone, maybe falling? Understanding other hormones such as cortisol, serotonin, growth hormone, insulin, etc. So this is where all the systems start to interlink with one another. You're all practitioners out there, so you'll understand this. It's not actually treating one aspect of someone's health. Nutrition is so important. Especially during the andropause. So, we want nutrient-dense foods, a good focus on proteins, healthy fats for our steroid hormones, and antioxidants, from fruits and vegetables, really very important. And a good focus on nitrates in food as well, in sort of like green leafy vegetables, beetroots, etc. So very, 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 very important. And someone might ask me an interesting question about those. But also minimizing our processed foods, sort of sugars, damaged fats, especially, seed oils, sort of processed foods, etc. Exercise, extremely important. Regular exercise, obviously good for cardiovascular health, but also resistance exercise for maintaining muscle, and that will also help with testosterone production. So also think about things like flexibility at this time, but also playing games to cement our social connection. It's not all about going to the gym. I've played paddle this afternoon with three other guys rather. So that having that social play as well is very important for a man at this time of life. Sleep, good sleep hygiene, really crucial for healthy testosterone production. Sleep deprivation, poor quality sleep, or fragmented sleep will lower significantly testosterone levels. Testosterone levels normally highest around 8 a.m. in the morning, lowest around 8 p.m. So sleep facilitates that sort of normal cycle, like a circadian rhythm. Research says that sleep disorders, such as sleep apnea, will affect testosterone levels. But also it's a vice versa. So like lower testosterone levels also are linked with sleeping problems as well. Stress management, we all need that. So chronic stress exacerbates andropause symptoms. Cortisol is a steroid hormone. Testosterone production can be effective. So using things like deep breathing, meditation, mindfulness, vagal nerve stimulation, I love that. Vagal nerve stimulation potentially help with erectile dysfunction. Regulates that autonomic nervous system, promotes that parasympathetic nervous activity, crucial for arousal. Having a positive mindset, so practices like gratitude, affirmation, focusing on strengths, so to contribute to that positive mindset around this time of life, but also avoidance of our harmful habits, that take us away from our goals. Excessive alcohol, we need to quit smoking. Substance abuse as well, will affect our hormonal balance. So, and therefore we then get worsening andropause symptoms. But yeah, social connections, so loneliness kills more people than smoking, so men are worse at maintaining those social networks. So it's all very important to maintain those social connections, reconnecting with our passions, our values, so our tribe as such, so like, who do you trust? Who do you want to be in your journey? Connections with like-minded individuals. So there are sort of like different projects of the Mankind Project, I think, there's sort of like Band of Brothers. They all help with this, sort of like men's social connection around that time of life. And yeah, next slide. Thank you. So yeah, so there's certain nutrients that we can look at as far as the andropause is concerned. So I mentioned arginine. This is something we find in the urea cycle. It's a precursor to nitric oxide in the body. This is the molecule that helps blood vessels relax. So it improves that blood flow, oxygen delivery. Can be quite useful to know your genetics as well, as far as your nitric oxide synthase enzymes concerned, and how you can actually support that. So methylation itself will help support the nitric oxide synthase enzyme, via the sort of the methylfolate that comes from the folate cycle through to the biopterin cycle, where we have the production of BH4, which then helps with the production of nitric oxide using the nitric oxide synthase enzyme. So that can be really helpful when working with men, to actually sort of look at the genetics as well. So beetroot, yeah, so packed with nitrates, but as are a lot of other sort of green vegetables, it's not all about beetroot. Yeah, so it's an interesting one, and it's something that I talk to my clients about as far as microcirculation is concerned, because yes, we've got the urea cycle that produces nitric oxide, but we've also got another way in which we can add to our nitric oxide load through exogenous means. So that's through nitrates in food. But it also depends on a good sort of oral microbiome and good stomach acid as well. Because what happens is, as we chew the foods that are packed with nitrates, if we've got the correct oral microbiome, those nitrates are converted within the mouth through to nitrites. And then the nitrites are converted via the stomach acid through to nitric oxide. It's a real boost to sort of nitric oxide within the system itself. So there's a few sort of caveats there, so if you're working with clients, making sure that they're not using sort of like mouthwash with fluoride in, which will sort of wipe out the good bacteria within the oral cavity. Tongue scraping can be another way of promoting that oral microbiome as well. Something that I do on a daily basis. So we can have a sort of an effect as far as nitric oxide production is concerned with food. Also, Panax ginseng. That can help alleviate symptoms of andropause. So it can help with improved testosterone production, enhance erectile function. So like just generally sort of have a positive effect as far as sexual function is concerned. Maca, sort of like both for men and women, sort of like potential for alleviating andropause symptoms. There's a study that they did in mice, but it can help with increased muscle mass, reduced body fat, sort of improved antioxidant activity as well. Ashwagandha, may help with the symptoms of andropause. by supporting testosterone levels, increasing DHEA in another androgen, reducing stress and fatigue, having that effect on the sort of like the nervous system as well. So sort of like a couple of ways in which ashwagandha can help the system as well. Nettle root, this is one I particularly like. It acts on a lot of hormone related pathways, especially those involving the prostate. So it contains lignans, and they inhibit the binding of androgens to sex hormone binding globulin. So we've got more free testosterone in the blood, but also the prostate receptors. So we get less sort of stimulation of cell turnover within the prostate as well. So more free testosterone. So the nettle root can be particularly helpful. Also, nettle will inhibit the 5-alpha reductase, so it prevents the conversion of testosterone to dihydrotestosterone, the more potent androgen that can lead to sort of things such as male pattern baldness, maybe anger, etc., etc. Pumpkin seed contains phytochemicals, support prostate health, reducing the impact of DHT once again. Blocking the conversion, so those easy to get into someone's diet. And reishi mushrooms can help lower cortisol levels, so has a benefit as far as our steroid hormone production is concerned within the body. So that was a sort of run through sort of like the andropause from my angle as much as anything else, but I think you'll agree that it's not just all about testosterone. It's also about the other changes that are taking place as a man ages, and I hope that's sort of given sort of a sort of wider picture as it were, and you can see how that can tie in with the cardiovascular disease, mental health, inflammation, etc. So I'm going to hand back to Ellen now. I think that's the time where you come back in and add to the party, as it were. So.
Perfect. So thank you, Mark. That was really interesting. I'm going to talk you through men's Pro-Multi in a minute, but just to highlight, there are a few of our supplements actually that are really beneficial for men, particularly during going through the andropause. So we've got things like vegan omega-3. Of course, everybody needs omega-3. It can help with cellular reception to hormones, so that's really good for helping testosterone as well. We've got glucobalance, and as well, Mark mentioned earlier about insulin resistance can be a particular problem in middle life. We've got Heart Pro as well, so for men that are concerned about their cardiovascular health, or maybe they have had a diagnosis of high cholesterol or poor cardiovascular health, that's a really good one to take. So Men's Pro-Multi, which is our star product for men, and I'll discuss that in a moment. Stay Calm as well, so really good for men that are going through trauma or really stressful times in their lives that can be affecting their hormones. Vegan Nights as well for men that can't sleep properly. Again, when you can't sleep properly, you end up having higher daytime cortisol levels, and that can then affect testosterone balance. So that's a nice one to take. And you've got ashwagandha, as Mark mentioned. Ashwagandha helps to lower stress hormone and can just help with that state of calm and encouraging the synthesis of testosterone rather than using all of that energy and initial ingredients to make the stress hormones. So that you can use this whole range of Dr. Vegan products. Our star product, though, is our Men's Pro-Multi. And if you look at everything that's in there, it's like your multi plus extra for men. So it's got in there things like some probiotics that are really good for gut health, can help with nutrient absorption, and also help with good moods and things. You've also got ashwagandha, you've got inulin, you've got beetroot, panax, ginseng, arginine, lycopene, beta-sitosterol, pumpkin, reishi, nettle, inositol, and maca. And let's have a look at some of these ingredients. So thiamine. So thiamine is actually essential for carbohydrate metabolism, particularly when the pyruvate dehydrogenase complex. In its active form, thiamine pyrophosphate, it acts as a cofactor for the enzyme pyruvate dehydrogenase, facilitating the conversion of pyruvate to acetyl coenzyme A. And this reaction is actually crucial for energy production. So as acetyl coenzyme A enters the citric acid cycle to generate ATP, it's therefore essential for the ATP production. Thiamine deficiency can impair this pathway, leading to metabolic disturbances. So again, any of your men that potentially have insulin resistance or heading down that pathway, thiamine is one of those essential ones that you want to be looking at. Okay, so we also have riboflavin. And again, this is another one that is essential for ATP production and can help give men a bit of a boom back. Riboflavin serves as a precursor for the coenzymes flavin mononucleotide and flavin adenine dinucleotide, which are integral to mitochondrial redox reactions. And these coenzymes participate in the electron transport chain, facilitating the generation of ATP. Okay, so next we've got vitamin B5, which actually is a precursor to coenzyme A. And a vital coenzyme A is vital in numerous biochemical reactions. And it's essential for fatty acid synthesis and degradation and the metabolism of carbohydrates and proteins. Again, so one of those nutrients that you need for normal energy production and normal glucose regulation. Vitamin B5 is also involved in the synthesis of steroid hormones that's produced in the adrenal glands as well. Then we come on to B6, which is also a cofactor in the synthesis of neurotransmitters such as serotonin and dopamine. And of course, they're essential for mood regulation. And deficiency in B6 has been linked to symptoms of depression. Supplementation with B6 can also help alleviate those symptoms. And also vitamin B6 helps to regulate the normal level of testosterone as well. So that can be really helpful in men. Okay, so vitamin B12. Okay, so again, it's a water-soluble vitamin and it is essential for various psychological processes, including methylation and the synthesis of DNA as well. And as a coenzyme, it's essential for proper functioning of the enzymes involved in synthesis of methionine and homocysteine. And of course, they're essential for DNA methylation and maintenance of genomic stability. So again, really important nutrient for men, especially men who are elderly, who, maybe are not absorbing B12 as efficiently as when they were younger. So they need to take high levels. Men that are on plant-based diets, vegan, vegetarian as well. This is an essential nutrient that they must have in there. And B12, of course, is also required for the synthesis of thymidine, which is a nucleotide, again, responsible for DNA replication. So it is actually essential for that DNA. And of course, when you're looking at fertility, making sure you've got healthy sperm, you need that B12 in there. Okay, so folate. Again, another one that's essential for DNA synthesis and also red blood cell formation, which again is needed for normal energy and vitality, and of course the regulation of homocysteine levels. So we want to prevent having excessively high homocysteine levels because that is a risk factor for cardiovascular disease. And when it's taken appropriately with B6 and B12, it can help to reduce the risk of heart disease in men. So again, it's really crucial, and it's also crucial for men who are considering fatherhood. It's been shown to improve sperm health and sperm motility as well as supporting cognitive function and reducing the risk of neurological diseases associated with aging. We are using the methylated form of folate and the methylated form of B12 as well. So if anybody's got any genetic polymorphisms on the MTHFR genes, this is a good one for them to take. Okay, biotin. So this is a coenzyme for carboxylase enzymes, which are involved in the critical metabolic pathways. including things like gluconeogenesis, fatty acid synthesis, and amino acid catabolism. And the enzymes are also essential for the metabolism of fats, carbohydrates, and proteins as well. Okay, so moving on to vitamin C. We also, you know, a lot of people don't have enough vitamin C in their daily diet. And of course, it functions as a potent antioxidant and enzyme factor in collagen. Also, it's needed for the immune system and neurotransmitter synthesis as well. So vitamin C enhances neutrophil function and reduces severity of infections. So really great for anybody that's concerned about their immune health going into the winter. And of course, it also acts as an antioxidant protecting against endothelial dysfunction, sorry. Okay, so let's have a look at selenium. So again, selenium is one of the more powerful antioxidants, and he has a huge role in protecting cells from damage. And it's needed for the creation of selenoproteins, including things like glutathione peroxidase, and it contributes to the maintenance of redox balance and supports immune system function. We also have chromium as well. So chromium plays an essential role in glucose metabolism and enhances the action of insulin, which is essential for maintaining blood sugar levels. Also supports lipid metabolism. And there are studies out there that suggest it may help with improving fat distribution and supporting healthy cholesterol levels. So again, if you have men that are concerned about their cardiovascular health, chromium is an essential one to put in there. And of course, it's particularly beneficial to those with insulin resistance and type 2 diabetes. So these are conditions that do become more common as men age, as Mark mentioned earlier. So having that additional chromium supplementation in there can actually really help to rebalance things. Okay, we've also got in there iodine as well. Of course, that's essential for production of T3 and T4, which regulates metabolism, thermogenesis as well. And in men, thyroid dysfunction can contribute towards weight gain, fatigue, and cognitive impairment. Okay, we also have zinc, which is another essential mineral, which is involved in the immune system and also the synthesis of proteins and in wound healing and DNA synthesis as well. And of course, it's also essential for male reproductive health. So particularly for its involvement in spermatogenesis and testosterone synthesis as well. So zinc has also been shown to improve prostate health, with studies suggesting that optimal zinc levels may reduce the risk of prostate problems. Okay, and we've got 2 probiotics in here as well. So probiotics are an essential part of the normal microbiome, and actually modern lifestyles unfortunately do not support a healthy microbiome. Too many people eat too much sugar, have too much stress, and also don't filter their water. So then you're getting that frequent dose of chloride, which is designed to kill bacteria. So taking a daily probiotic actually can be really beneficial for men, not just men, everybody, but men also can benefit from that. We've got lactobacillus in here, which of course contributes to health by balancing the intestinal microbiome and also helping with the digestion of lactose and the production of short-chain fatty acids, which then get absorbed and are used in the body. So L-acidophilus has also been shown to enhance immune function and prevent gastrointestinal infections as well, and reduce the such conditions such as irritable bowel syndrome and diarrhea. Okay, so I've gone a bit ahead. Okay, so we've also got bifidobacterium bifidum in there, okay, which is of course another great probiotic which produces short-chain fatty acids, and again is essential for regulating intestinal health, and also reducing things like constipation and just helping with nutrient absorption, which of course is one of the biggest one of the main factors we look at when we look at supporting overall health. Okay, so we've got ashwagandha again, which is an adaptogen, and we've talked about this a little bit earlier, so I'm not going to go into too much depth. but it does help to regulate the HPA axis and supports a reduction in stress. And of course, that has multiple benefits for things like cognitive function. And actually, it has been shown to improve memory, attention, and executive function as well. Okay, we have inulin in here as well, which is, everybody knows that's a probiotic. So it feeds the good bacteria in the gut, and then those good bacteria then produce short-chain fatty acids, which then have that positive effect on health. Inulin has also been shown to help balance blood sugar levels as well and reduce body fat in individuals with insulin resistance. So any of your men clients that do have insulin resistance, pre-diabetes, or even type 2 diabetes, inulin is a really good one to give them. And we've got beetroot in here, as Mark mentioned earlier. So again, that converts into nitric oxide, and then that plays a role in vasodilation and can actually be really supportive of blood flow and heart health in general. So of course, when we're looking at men, we're looking at their ability to exercise and blood flow in general and cardiovascular health, as well as things like erectile dysfunction as well, which can come along with poor blood vessel health. Panax ginseng, again, that's one of the great adaptogenic herbs. And the studies actually show it to improve mental clarity and support immune function, as well as supporting physical function as well, helping to increase endurance of exercise and helping the body's ability to handle stress. It also has neuroprotective properties as well, and can also enhance cognitive function. So if you have any men that are concerned about loss of cognition in mid to later life, memory, mood stability, Panax ginseng is definitely a good one to give them. And arginine as well. So Mark touched briefly on that. So again, it can convert into nitric oxide and lead to lower blood pressure as well. And may be helpful for people, men with heart issues or poor blood flow, and also things like erectile dysfunction as well. So arginine can also contribute towards muscle growth and increase the delivery of nutrients and oxygen to muscle tissues during exercise. Can also help to speed recovery as well. So great for any of your gym buffs. Lycopene. So again, this is a really important nutrient for men. So found mostly in tomatoes and other red fruits, and has been studied extensively for its role in prostate health. And there's numerous studies that suggest that lycopene's antioxidant properties may help protect cells from oxidative damage. It also has protective cardiovascular benefits as well, helps to reduce LDL cholesterol oxidation, which of course is a major factor in atherosclerosis. Okay, so moving on, we have beta-sitosterol. So this is a phytosterol that is structurally similar to cholesterol. And it's been shown to alleviate symptoms of benign prostatic hyperplasia as well. So those symptoms include frequent urination, nighttime urination, and it works by inhibiting the conversion of testosterone into dihydrotestosterone, a hormone that promotes prostate enlargement. So a lot of men do have enlarged prostates. So this is something, you know, you do need to watch out for, and maybe get checked if your male clients do have symptoms of that. Okay, pumpkin seeds, again, as Mark mentioned that earlier. Excellent for prostate health, contains again beta-sitosterol and delta-7 sterols, which help to reduce symptoms of benign prostatic hyperplasia, and supports urinary health in general as well by improving bladder function. So again, a really good one to add into a men's multi. And you've got reishi mushrooms again. So these have a really good immune boosting and anti-inflammatory and adaptogenic properties. And the active compounds include terpenoids and polysaccharides, actually, which do enhance the immune system and increase the activity of white blood cells and promote the production of antibodies as well. So again, it's really good for cardiovascular health and improves blood circulation and reduces blood pressure. Okay, this is a very extensive formula, as you can all see, but we are getting there. Okay, we have nettle root in there as well. So again, as Mark mentioned a little bit earlier, nettle supports prostate health in men with benign prostatic hyperplasia, and it's got the lignans and the sterols in there, which do help to reduce the production of dihydrotestosterone. It's also anti-inflammatory as well. So again, anybody that's got any benign prostatic hyperplasia, again, this is one that you definitely want to add in there. But you also have inositol in there as well. So that's a sugar alcohol, and it plays an essential role in cell membrane function and insulin signaling as well. So again, great for regulating blood sugar, improving insulin sensitivity, and also reducing anxiety and depression as well. So again, if you have got middle-aged men that kind of losing their will to live, have some anxiety, have some low moods, this could potentially be quite a nice one to give them. Okay, and lastly, but not least, we have maca. Again, as Mark mentioned, is an adaptogenic herb, and that enhances energy, stamina, and endurance as well, and also been shown to improve sexual function and libido and erectile performance. It does this by increasing testosterone levels and promoting hormonal balance. So again, this is a really good one to add into the formula, and that is the last ingredient. But as you can see, that's a really comprehensive formula. So not only is it your multi, so you've got all your essential vitamins and minerals in there, you've got all of those added extra things in there, which really support men's health. Even, you know, guys in their 20s that want to get the most out of their health, improve their physical performance, going right up to middle age and right into men in their elderly age as well. This is a great formula for them. Okay, so here is the extensive list of references that we use today. If you want a copy of these, just drop me an email. I can put them in an email for you. You can click the links, etc., etc. Okay, so many. Okay, so we're going to have a Q&A session now. So let me just have a look, see what questions we have. Okay. Okay, so we have one from Mark. Okay, so Mark, how can you naturally lower sex hormone binding globulin?
Yeah. Okay. So this might be something you need to look at. See, I mean, I do blood testing, and I can see sometimes that's high with certain clients, and therefore it will bind the testosterone. But so certain things you can do, sort of like making sure you have good quality protein in the diet. That's been linked to lower SHBG levels, especially in older men. So good sources such as, you know, meats, fish, eggs, etc., legumes, nuts, seeds, making sure they're in the diet. Increasing zinc intakes, you know, that the zinc is good zinc levels is associated with lower SHBG levels. So you can do that with supplementation or with foods, you know, so oysters. But also at the same time, limiting things like sugar and caffeine, alcohol. These tend to push sex hormone binding globulin up, you know, so but other things, sort of just maintaining a healthy weight, making sure, because that can affect overall sort of hormone balance. Also ensuring adequate vitamin D levels, you know, so you know, sort of like when you've got low vitamin D levels, they're associated with higher sex hormone binding globulin. So once again, big area of life where, you know, so we want to be pushing people's vitamin D levels to 100 nanomoles per liter, you know, and above, you know, making sure that they're sufficient. Avoiding trans fats as well, you know, that's processed foods, lower testosterone levels generally, and lower free testosterone levels because of the binding to sort of sex hormone binding globulin. So that's you know, and that will be, you know, for men and women, you know, to make sure that you have healthy levels of that particular protein in the body. So yeah. Thank you.
Perfect, thank you. Okay, so I do have another one here, actually. So I can answer this one, Mark. So is men's pro multi useful for infertility? Yeah, so I would say, obviously it depends on the cause of infertility. Like, obviously if you've got genetic reasons for it, it's not going to help that. But in most cases where you have low sperm count or low poor sperm morphology, or lower testosterone, then yes, absolutely, it can be supportive of that. So you've got nutrients in there like zinc, which helps to regulate testosterone levels, and also there's a lot of zinc that's needed for seminal fluid as well. So you need to have the zinc to protect the sperm cells. And again, you've got things like arginine in there, which are improving blood flow to the testes to make sure that those sperm cells are actually nourished properly. Also, there's selenium in there as well. So selenium, again, is a potent antioxidant. So it helps to protect those sperm cells from oxidative damage. And vitamin D. So vitamin D is essential for the regulation of all the hormones in the body, including testosterone as well. And you've also got folate and B6 in there again, which was, essential for DNA synthesis. So absolutely, if you worked out that the cause of their infertility is low sperm count, poor sperm morphology, poor testosterone, absolutely this one can be a really helpful product for them to take. Okay, and one more question as well. So Mark, someone said that they've heard that vitamin D is actually important for vascular function. Could you explain why that is?
Yeah, this is really quite interesting in the fact that when we're talking about what vitamin D will do, it will enhance nitric oxide production. So when we're talking about vitamin D, vitamin, it should be, and I know it's very trendy, but it should be talking about it in terms of it being a hormone. And actually, nitric oxide itself is almost hormone-like in its action. So what happens is vitamin D attaches to the vitamin D receptor, which sort of acts like a transcription factor for the production of endothelial nitric oxide synthase. So you need the two together. So it's almost like everything works in synergy. So vitamin D levels, once again, very important for nitric oxide production. So it promotes nitric oxide synthase, it then promotes more nitric oxide, that promotes the vasodilation. And also, don't forget that vitamin D has a modulating effect on the immune system as well. So, sort of like once again via the vitamin D receptor. So therefore, will sort of help with regulating inflammation levels in the body. So, both ways. That's how it works. So, very important, vitamin D.
Okay, and we've got one more question, Mark, if you don't mind just quickly covering this one. So somebody has asked how to support a varicose patient.
Varicose patient. Okay, so just so remind me there. So how's that presenting?
Doesn't it present in? I think it's a swollen testes, isn't it, or something to do with the blood vessels within testes?
All right. Fair enough. Yeah. Okay then.
I think that's what it is. Yeah.
Okay. So generally, Vanessa, I think we just look at sort of like general health considerations, and I still think that making sure that we're looking at sort of microcirculation is probably very important as far as the whole sort of delivery of nutrient around the body is concerned. So I would definitely look at making sure we were enhancing nitric oxide levels everywhere. So there are a few besides the sort of nitrates from foods. I would also look at maybe some of the enzyme support as well. So looking at things like nattokinase, serrapeptase, etc., to sort of help with sort of fibrinolytic activity within the body. I think that will be a way forward. So that would be my way of looking at it.
Perfect. Thank you so much. So actually we are running quite late, so it's nearly 7:20 now. So unfortunately we didn't have any time for bring us to the end of this evening's webinar. So just to remind everybody, we will be sending out a recording of this webinar as well. And thank you to those of you who have joined us live. You will get an email after this to say thank you for joining us live and to tell you how to claim your free product of Men's Pro Multi. So if you're a man, try it yourself. If you're a woman, give it to your loved one or a family member or client and see how they get on. But do utilize this opportunity because it's really good to see products firsthand, how they work. And of course, that is free of charge, and that's a thank you gift for attending live. And I will remind everybody our supplements can also be purchased from Natural Dispensary. So we do sell, of course, online at the DR.VEGAN website, through Natural Dispensary, and of course in a variety of health shops as well. So do look out for us. And of course, anybody that isn't signed up to the DR.VEGAN practitioner scheme, why not? It is one of the best things that we do have, and you can get so many benefits on there. Commission, clinical news, free monthly products as well, and practitioner only perks to support your clients and also to help elevate your practice to the next level. So why not sign up if you haven't already? You're missing out if you haven't done that. And if anybody does have any further questions, do drop me an email. My email address is on the screen there. If you have any questions for Mark, just send them to me. I can forward them to Mark as well. And I want to say a huge thank you, Mark. That was a really interesting webinar, and it's been fantastic having you on this evening.
Yeah, thank you. Thank you very much. Enjoyed it. And yeah,
perfect.
I will say that the Pro Multi for Men is very well formulated. I like it very much. So there you go.
Perfect. Thank you for that. And I hope everybody has a lovely evening, and we do hope to see you on our next webinar, which it will be coming up in December, so do look out for that. Okay, thank you everybody. Have a good evening.